Hi, my name is Dr. Sasha Hakman. I'm a double board certified OBGYN and reproductive specialist at HRC Fertility in Beverly Hills, California. And today we're going to talk about fertility and lifestyle with Dandy. So exercise has a lot of different benefits, but primarily it can help with infertility or improve fertility if you have ovulatory dysfunction. And a lot of times this ovulatory dysfunction is related to either suffering from overweight or obesity and or having insulin resistance. When you do things like resistance training and you are building your muscle mass, it can help to reduce that elevated testosterone that is often seen with insulin resistance. And we typically see this the most with women who have PCOS. And it can help to improve your metabolic rate and all sorts of endocrine parameters that can negatively impact your chances of ovulating in a predictable way. The exercise that I typically recommend for women who are trying to conceive is to absolutely do a few resistance training sessions per week. Technically speaking, the recommendation is 150 minutes per week of exercise, with at least a few of these sessions being focused on resistance and strength training. There should also be some form of cardio incorporated, and ideally once a week, that cardio is involving HIIT training. So you're really increasing your heart rate, maximizing that. It is totally okay to have vigorous exercise even on a daily basis, but when you are trying to conceive, ideally you want to minimize that and limit it to about 1 hour a day. When you're in a treatment cycle, recommendations vary because there's actually no evidence-based guidance, including any guidance from the American Society of Reproductive Medicine, which makes it a little bit challenging for different doctors. So a lot of women will be told to completely stop exercising during their stimulation cycles. Now, my recommendation is to essentially listen to your body. If you are feeling up to exercise, you can absolutely continue. And there's only one very small clinical trial that showed that there was no increased risk of ovarian torsion. This is the main reason why physicians are scared to let their patients exercise, is that the ovaries are enlarged and there's this concern that it can twist on itself, cutting its blood supply, which turns into a surgical emergency. So obviously that is something we want to avoid, but there's actually no evidence to show that exercising during stimulation increases the risk of ovarian torsion, but the satisfaction of treatment is certainly increased if you get to continue exercising. If you feel like you can do HIIT training and it is not physically bothersome and you're not feeling your ovaries jumping and moving around in your pelvis, then it's probably okay. Like I said before, there is no evidence in terms of what exercise is okay or not okay. This also really depends on your ovarian reserve and the amount of follicles that you have responding. So if you, for instance, have diminished ovarian reserve and there's only a handful of follicles that have actually grown in response to medications, it's probably okay to honestly just go all out the entire time. But if you have, for instance, really high ovarian reserve and there are 30 plus follicles responding, the ovaries are much larger, then you're probably gonna feel it a lot more, you're gonna be more uncomfortable, and maybe during that time period, things like HIIT training, jumping around, running around, is just not gonna feel comfortable. And if it doesn't, you should really listen to your body and go with how it feels. So when it comes to the fertility diet, what a lot of it is really centered around is a Mediterranean style diet. It's not just for fertility, it's for overall health, it's for longevity. And what it's really focused on is whole foods. That is where the protein is more focused on plant-based or fish type proteins. So less meat, less chicken, beef, all the red meats included. It doesn't mean that you should be eliminating that, it just means reducing its consumption. The main thing about the Mediterranean diet is that there are healthy fats like avocado, chia seeds, nuts, olive oils, and these things can all be really beneficial to your metabolism and to your overall health. But the biggest thing is really just whole food. So you want to minimize ultra processed foods, anything that comes in plastic containers. All of these things can negatively impact your reproduction. With certain foods that are particularly processed, the biggest concern is endocrine disrupting chemicals that you're exposed to, as well as microplastics. Now, we can't really avoid that completely. It's sort of everywhere in our environment. So this isn't to create any sort of paranoia. It's more so to just reduce exposure. So things that are coming in containers and packaged in plastic, some things you just can't avoid. Oftentimes when we get fish, for instance, it will be in a plastic container. Not much you can really do about that. However, it's a matter of limiting exposures. But keep in mind, when it comes to produce, another big concern is exposure to pesticides. And those can really, really harm fertility. In a perfect world, you would try to get produce that hasn't been sprayed with pesticides. Organic is helpful, but it doesn't necessarily mean that it hasn't been sprayed. Typically, local farms are the places to go in order to avoid that. But alternatively, if you have no other options, then it's a matter of really, really thoroughly washing and cleaning your produce to try to minimize the chemicals that they've been exposed to. And so there's a lot of myth around avoiding gluten, avoiding dairy, that it worsens the inflammation that's associated with PCOS. But the reality is that you really just want to focus on high fiber carbohydrates with low glycemic index. The fiber component is super important, like whole grains, for instance, and legumes, which still count as your carbs. You do still want to focus on primarily plant-based proteins. You can stick to a pescatarian diet. And although many think that you have to limit the amount of fish you eat in a week, that actually hasn't been shown to be true as well. We know that omega-3s are beneficial, once again, for overall health, but also for fertility. This can actually improve egg quality. We know it's really beneficial for pregnancy, especially when it comes to baby's brain development, things like DHA. This is why you'll often see it as supplementation in either prenatal vitamins or on its own. But you can actually get that from dietary sources, from things like salmon or other types of fatty fish, nuts, seeds, particularly chia seeds. So you can get a lot of these healthy fats. Now, we know that omega-6, for instance, is super inflammatory, and that's the kind of fat that you want to avoid consuming. And omega-3s can be anti-inflammatory, has really powerful antioxidant effects, and that is what can help improve egg quality as well as sperm quality. So caffeine, when it comes to trying to conceive and pregnancy, is this other controversial thing where some studies have shown you could have up to 5 cups of coffee in a day and it won't impact your fertility, will not impact pregnancy, but other studies have shown the opposite to be true. So the general guideline, as directed by the American Society of Reproductive Medicine, is to limit caffeine intake to 200 milligrams a day. Now, if there is a particular day that you had a little bit more than that, it's probably not going to negatively impact anything, but limiting your caffeine intake to, say, for instance, 1 to 2 small cups of coffee a day is ideal. And that's the same for fertility treatments, transfer cycles, and pregnancy altogether. So it's really hard and overwhelming when you start learning about endocrine disrupting chemicals, which, to give a little bit of a background on what they are. So what endocrine disrupting chemicals do is it can change hormone function, including your reproductive hormones, and it can also long-term increase chronic diseases and cancer risk. The places that they are is kind of everywhere, but the most easy and obvious places to start eliminating are things like fragrances. So we know that things like perfumes and fragrances emit volatile organic compounds, or VOCs, because oftentimes we will find that embryo development halts because it can cause some breaks in the DNA strand and negatively affect embryo development. So it's kind of a big deal. So an easy place to start eliminating endocrine disrupting chemicals is to avoid use of perfumes and fragrances. Fragrances are seen in our laundry detergent, in our household cleaning products, and so opting for more non-toxic products to clean your house and clean your clothes is a really easy first step. Alternatively, when it comes to drinking water, oftentimes you might be drinking from plastic water bottles. I think that it's pretty well established by now that plastic is not great. And so when it comes to drinking water, you ideally want to drink out of a glass container or stainless steel, these reusable bottles that are not plastic. And this is because microplastics can leach into your water, especially if it has been exposed to the sun or any warm temperatures. So heavy metals are becoming a lot more popular. Patients are often asking me about this. The reality is that heavy metals are kind of everywhere as well, and it's even in the air that we breathe, so it is really difficult to avoid. When it comes to the pollution in the air and all of the different EDCs that we are inhaling on a daily basis, one possible implementation that you can do is when you are at home is having air filters. So it's hard to directly correlate elimination of endocrine disrupting chemicals and impact on IVF outcomes. That being said, there are about 15 to 20% of cases of infertility are unexplained. We know that in some cases this could be due to an undiagnosed endometriosis that could have negatively affected egg quality, but we also know that for those who have a genetic predisposition for things like endo or PCOS even, when you are exposed to these environmental factors, it can worsen the disease or even cause its onset. And so naturally, if you're eliminating some of these environmental toxins, we presume that egg quality will be improved and ultimately lead to better IVF cycles. And it's not only the eggs, it's also the sperm. Something that people don't really realize is that while you are sleeping, your brain is actually working really hard to secrete some important reproductive hormones to really organize and synchronize your cycle so that you are ovulating in a predictable way and that everything in terms of your endometrial lining is getting prepared in response to hormones. Now, in some cases, and everyone has their own sort of predisposition of how sensitive they are to sleep disruption. If sleep is disrupted, it can interfere with this normal secretion and pulsatile release of hormones from the brain that talks to the ovary and even to the uterus. And so, for instance, we see that those who do night shifts or night shift workers tend to have poor outcomes when it comes to reproduction, and that's because they're up all night and their sleep is completely disrupted. Women actually do need more sleep than men, and ideally you're getting a minimum of 8 hours of sleep per night, and ideally high quality sleep. You want to get into that deep sleep so that you really feel refreshed and your whole body is just functioning the way that it should. If you're just starting your fertility journey and you're really wanting to improve lifestyle, it's really important to, first of all, do your research, get to learn more. So it's important to do your homework, to learn more about nutrition, to learn more about how macronutrients work, what your caloric needs are based on your personal body. If it becomes a little too overwhelming to learn this stuff, then working with a dietitian or a personal trainer and learning techniques when it comes to things like weightlifting can be a really, really great investment. There's also so many resources online and on Instagram with various sports accounts that will teach you all of these things when it comes to lifting weights. So the second thing is really trying to shut out any thoughts when it comes to the intimidation of incorporating resistance training into your life. People underestimate how important resistance training truly, truly is. And it's not just for fertility, it's for the rest of your life and your overall health and functionality. It can be very overwhelming when you don't know what to do, but you just want to take one step at a time. Learn gradually, learn about the techniques. You're not going to lift heavy weights overnight. It's going to happen if you are consistent. And that brings me to point number 3. Consistency is key. So you want to improve your lifestyle in a stepwise fashion. Incorporating too many things all at once can be daunting and set you up for failure. So you want to change possibly one bad habit at a time, and you want to stay consistent with it so that even if you do have an off day, that's okay. It's not about being at 100% every day. It's all about just staying consistent. So if you're hoping to learn more about fertility and lifestyle, feel free to check out my website at sashahakman.com, or alternatively checking out Dandy's website to get a lot more incredible resources and information when it comes to your fertility journey.